Hello, dental online trainers, and welcome to the Dental Online Training Sharecast. I'm your host, Dr. Dennis Hartlieb. Each month, I'll be talking with dental experts who are doing amazing work in the field of dentistry and talk about how they got to be where they are today, what their influences were, and their journey in the world of dentistry. And as a bonus, I'll occasionally throw in a few of my solo bonding sharecasts, where I share a little of my experience with you about what's going on in my practice and lessons that I've learned along the way. So tune in every other week to hear our latest episode. Hello, dental online trainers. It's Dr. Dennis Hartlieb back with you again for another of our wonderful sharecasts. Today, I have a great pleasure of bringing in and speaking with one of my dear friends, Dr. Brad Olson. If you don't know Brad Olson, let me tell you a little bit about him. Brad is just a recently retired practicing dentist, but his background, I think, is really interesting, and that's why I wanted him to come in and talk about what he did and how he got through and what he was doing in his career. What you need to know about Brad, he graduated from the University of Maryland Dental School back in '83, I think. Is that right? Right. Yeah, I remember there. And then he got involved with the AACD. And if you're not familiar with the American Academy of Cosmetic Dentistry, I've spoken about it a number of times in my podcasts. We've talked to Amanda C., Adamo, who needs no last name. He's like Cher, he doesn't need a last name. Brian Lesage has been on our podcast and talked about it, Corky Wilhite. And Brad, not only is he accredited, not only is he a fellow, but he sort of led the fellowship at the AACD for a number of years. Brad is he's in the Hall of Fame for the AACD. I think there's maybe 7 members of the Hall of Fame. I mean, this is for the super distinguished people who've given so much to the Academy of Cosmetic Dentistry, and that's an accolade that absolutely must be acknowledged. He's also a fellow member of the Academy of Restorative Dentistry, and I had the pleasure of Brad serving with me on the committee over the last couple of years. We've been working together. And so as someone who's gone through so much with cosmetic dentistry, and I know that what I want to talk to Brad about is his transition into more complete dentistry, more complex dentistry, where his practice was. I know he had some transitions in his practice. He had a partner, I think, who went into disability, and he had to sort of rethink his whole practice. So, Brad, welcome to the podcast. It's awesome to have you.
Thank you, Dennis. Thanks for having me. Appreciate it.
So I got a few questions for you. So
Sure.
One of the things that I find so intriguing and interesting is how did people get into dentistry in the first place? So talk to me about Brad Olson as a kid and influences that sort of led you towards where you are and how you got into dentistry.
Yeah, mine was actually just, it was, I don't know if you call it straightforward, but, in 6th grade, it was determined that it was time for these big teeth and small mouth, things weren't going to fit right. And so, referred by my general dentist to the orthodontist, where, of course, they do all the records, everything. But here was the interesting thing that happened. And, kudos to this orthodontist, is that when we came in for the consult, he had 3 chairs. He had one chair that sat right next to him at his desk, and he had 2 chairs in the back of his office. The chair up front was for me. The chairs in the back were for my mom and dad.
Nice.
And so he sat and he never looked at mom and dad. And he looked me right in the eye and he explained exactly how this was going to work. And he had models to show me how this was going to work. So he had his before models, and then he had his, we didn't, that was not a lot of digital in that day, Dennis.
We didn't have cell phones in that day.
Exactly. So he sawed the models, he'd taken the teeth, he'd removed the 4 bicuspids, he'd wax the teeth back into place, and he showed me a model of the way my teeth were going to look after he completed his work. And he said, if you do everything I say, in 2 years, I will take off your braces. You'll only have to wear them 2 years, but you have to follow all my directions. Well, that's one thing I was always pretty decent at. 2 years to the day, he took off my braces, and they looked exactly like the model. He brought the model out again, and he said, here's what I told you.
Wow.
And here's where you are now. And I was blown away.
That's awesome.
Like, that is just way too cool. I have to do this for a living. I have to be an orthodontist.
That's a great influence. Wow. I I was taught by one of my instructors at dental school. He said, "Hey, Dennis, treat your adults like children and treat your children like adults, and you'll have a successful practice." And wow, I guess some of my adults I do treat like children. But what I have found working with teenagers, especially for cosmetic cases, is talk to the kid, right? Address the kid. And I tell you, that was such valuable advice. And if you can get the kid on board, then treatment goes so much easier, right?
Absolutely.
I think the toughest
parents, we know that, I mean, when our kids are happy and satisfied and excited and following directions, our lives become so much easier.
I don't know if you found this in your practice, but I find when I can't get a kid engaged, when we're talking about if they have peg laterals, congenitally missing laterals, whatever the case is, if I can't get them involved, it becomes a tougher case. They're harder to work with. They're I don't know. Did you find that also?
Absolutely. And, remember, we're working with that age group. We're also working with a real lack of compliance just right out of the gate.
Right.
That's just the nature of being a teenager. But it's funny how when they're engaged, that compliance turns around. They're excited. They're part of the team. They're part of what's about to happen. So all of a sudden, they're not breaking temporaries. They're not snapping off incisal ledges of composite. They're not coming in with gums that are red, pumping, bleeding, blood everywhere, because they're excited. They're part of the action of what's going on. Agree completely.
I love how he showed you what it was going to look like. And then at the end, he brought out the cast to show you this is what we achieved. That's really powerful.
Absolutely. Difference maker. And I'm from that day forward, I'm an 8th grader. And you can look back in my yearbooks and said, hope you have a great career as a dentist. I'm going to come to you when you're a dentist. I mean, when people sign your yearbook at the end of the year, I have all these high school yearbooks of all these comments about being a dentist.
That's so cool. Did you have any dentistry in family? Any members that?
None.
Yeah.
Nowhere along the line.
I found also, because I knew early on I wanted to be a dentist. I was just influenced by my dentist, who was a nice guy. He worked with his hands. My dad was an auto worker, so sort of grew up doing stuff on cars and stuff. And I just loved the idea of being able to serve people and help people. And I didn't want to go into medicine. I didn't like our physician. I knew as a young person, I didn't want to have to tell people that they were dying. So I knew I wouldn't want to be a surgeon. Yeah. I didn't want to have to deal with those type of issues. So I found that it was easier for me when I was going through school, especially when I got to undergrad, that I knew what I wanted to do. And I could just be laser focused on that. And whereas, colleagues in college that didn't know what they wanted to be when they grew up, they had a harder time, I think, in undergrad because they didn't have that same direction. I don't know if you experienced that also when you were in school.
Yeah, absolutely. And I watched it with lots of friends as well. Even guys coming along like, oh, Brad's going to want to be a dentist. I think I'll be a dentist too, and then they get into, bio and organic chemistry and all the other stuff, all the other road part of that. They're like, yeah, no, that's not, this is nonsense. I'm not going to be part of that. But, Dennis, the other part of it I didn't share with you, the influence continued because remember, this is back in the 1960s and my dentist did a lot of gold foil. He always used a rubber dam, always used a rubber dam, wow. Always wore a mask. Now, he wasn't gloved, but this is the 60s.
That's pretty progressive.
He sat down when he worked.
Wow.
He had four-handed dentistry with a rubber dam. I saw early on, like, wow, this is somebody who, at the time I didn't equate, but then you look back and you're like, this guy was serious about being the best that he could be.
When you went to dental school, it's interesting. I think if you have that kind of positive experience and then you have to use a rubber dam in dental school, for you, I'm sure you're like, well, yeah, that makes sense. For the rest of us, we're like, I can't wait to graduate so I never have to use this thing again. Right?
Yeah, right. Until you learn that, like, and especially in dental school, when we're our own assistants,
yeah,
can you imagine how would we have done that without a dam? I mean, it just, you look back and you think, how could I have ever done this stuff? So
that's why we have a mentorship program at Marquette, and I tell my proteges, I say, your rubber dam is your dental assistant. And it is in dental school, and I think even in practice, I can't even imagine practicing without rubber dam usage in my practice. It's so invaluable on so many situations. And it's great that you had that influence coming out. That's pretty cool.
And look how red hot it is now. You know, you've got
sexy
Adama and Amanda teaching it. You've got Celine teaching it. You've got, you know, this is like become the new, you know, genre of how you do top end elite dentistry.
Yeah, I mean, it's interesting, right? Rubber dam has become very sexy in the world of dentistry. It's crazy.
Yeah. And I mean, I always used it, but I used it probably in the traditional sense. And I look at some of the things that they're doing with it now, and I'm like, that's different.
Yeah.
I didn't use it that way.
I just took Celine Hickton's course at the AACD, and I got to tell you, my game up this past AACD meeting, up my game on rubber dam level. I mean, I'm 60 years old, and between Celine and I'm trying to remember who else. I can't remember. Is it Caesar from Peru?
Yeah.
And I'm trying to remember who else I saw. But I mean, all of a sudden I'm ordering more B4 clamps, and I'm ordering all sorts of clamps, and I'm using it so much more in my practice because I see how helpful it is, and I've experienced it just more recently how much easier it makes the dentistry if you don't have to worry about managing the patient's tongue and their lips, and you can just concentrate on the dentistry.
Absolutely so. No question.
You know, one of the things, and I felt guilty putting rubber dams on people because I never loved. I had rubber dam dentistry done when I was in dental school, but I didn't love it. But so I felt guilty. But now I've sort of gotten over that. And Celine said something. You know, it makes it easier. And you know what? Maybe it's just because where I'm in my stage of career. It's like I want it to be easier because dentistry is hard enough. You know.
I only caught little bits and pieces of Celine because I was moving around, but I was in there when part of her lecture, when the value of that was she was talking about the communication level. That's where it needs to start.
Yeah.
And you don't have to feel guilty because you've already set the table. You've explained everything. You've put it in place. You've got it, as opposed to just coming at somebody with open wide, and you're coming with this, driving home with this clamp and stubbing this rubber thing in their mouth. It's like, of course, they're probably going to be intimidated, frightened, overwhelmed.
Yep.
But when you've laid the groundwork in communication, like everything else that we do,
yep,
world becomes easier.
Where'd you go for your undergrad before you went to dental school?
College Park, University of Maryland. Yep. I came from a very middle class family, Dennis, and it was. It was clear to my family what I wanted to do, that, schooling was going to be 8 years. At least, because I was still hot on being an orthodontist, which meant that was going to be, add on 2 to 3, whatever it was at that time. And so I had an interview at Georgetown, had an interview at Duke, and I was set to go do those. And my dad sat me down and he goes, just so you understand, we can afford for you to go to College Park, and you can live at home, or you can go live on campus if you want, but the financial help you're going to get here from us is the semester tuition and books. That's it. If you want to join a frat, if you want to live on campus, if you want to go to these private universities, that's going to require loans. And then also you got to keep in mind that 4 years after that, you will have loans. And then if you do years after that, you will have loans. So I just want you to consider the economic. And when I took me about 20 seconds to look at that and go Terps. And Dennis, people are going to love this because I'm 60. I'll be 68 this year. So this was back in the mid 70s. Tuition for an entire semester, regardless of how many credit hours you took, was about $390.
Oh my goodness, isn't that crazy? Isn't that crazy?
And you think now of these. I'm laughing. I shouldn't be laughing because I think now of these dentists that come out just absolutely buried in this huge debt service that they have. And, obviously I had dental school debt, and it was heavy at the time for us.
Sure.
Too. I don't know how you were, but it was heavy, but it was, I would call it manageable.
Yeah. I mean, it was stressful. I mean, we were making, I think generally what young dentists are making out of school is way more than what I was making, but their debt level is so high today. And so, yeah, I think manageable. It was no fun. It was painful paying back the debt. It wasn't like I was making so much that it was like a no-brainer. It was painful, but we just managed through it like everyone.
You live lean, that's what you did.
That's exactly it.
Yeah.
So when you're in school, and then applied to dental school. You just did you just apply to Maryland then? Was that like sort of your destination?
No, actually, it was the same routine again because I had an interview set up at Georgetown. I had an interview set up at Emory. But I wasn't, Maryland was always choice one by far, but you don't know where you're going to get in and where you won't get in, you know? And so I had those two set up, but no, Maryland, got the letter from Maryland and called up Georgetown and called up Emory and thanked them very much. And, you know, said, this is where I'm going to be. So
what do you remember when you walked in the first day of dental school?
Yeah, I made a huge mistake, Dennis. I didn't do my homework very well in dental school. I thought that it was almost like a vocational school. Okay, that you're now accepted into the club. We've accepted you. You're a dentist. We're just going to simply train you to be a dentist. Okay, straightforward. So I lived that summer at the beach, worked at a restaurant, you know, finishing up at midnight, getting with my friends, partying until 2, 3 in the morning, sleeping till midday. And I did that virtually up to 48 hours before I started dental school classes.
Okay.
Huge mistake. Big mistake. So the little slip in my, about halfway through the first semester, that little pink slip in my mailbox regarding my scores in anatomy was a very, very quick wake up that you're not in Kansas anymore, my friend. You know, this is serious business and these people aren't fooling around. So I had to really giddy up at that point in time and drive forward from there.
I remember when I was at Michigan, I went to Michigan undergrad. And so, you know, I had a certain arrogance and I thought, well, I mean, I did fine at Michigan. Dental school should be a breeze. I went to Michigan and then I got in there and I'm like, oh my God, these people are so smart. Oh my God. I thought I was working hard in undergrad. Geez, these people are so smart. And I mean, some of just the best people in the world, but they were so smart. And I was blown away about how hard I was going to have to work once I got in. I didn't.
Well, Dennis, I don't know about you, but, you know, I had classmates that had worked in labs. They'd worked in dental offices. All these different things. And, you know, they hand me a spatula and a tooth and some wax. And I'm like, whoa, what's this? That's where, you know, I look 2 stoves over and they're just going, you know, just going to, you know, like, damn, how far behind the curve am I?
Right. Yeah. I think I can speak to that too. Do you remember your first patient that you actually treated, that you did a procedure on?
You know, I mean, are we talking dental school? Or are we talking
dental school. Do you remember back then?
I do remember. I do remember a sweet lady, occlusal amalgam, and absolutely freaking out because it set on me so fast.
Right.
That I was like, you know, I wanted to take time to carve this thing. And it's like, why was it different than the ivorine? I don't get it. You know, I mean, I piddled around with ivorine and seemed to be fine.
Yeah.
So yeah, I think everything really slowed down from that point in time. And so I remember, but you know, like many of our dental school patients, sweet as can be, patient, all get out, you know, just, you got this, honey, you know, you're going to be fine. And so it was, you know, it was actually a fine experience, but you know, like all of us, it was like, wow, this is different.
When you were finishing up with dental school, were you still looking to go into ortho, or what was your thoughts?
Yeah, you know, dental school kind of cured me of ortho. And I, you know, it's interesting, Dennis. I did an endo. I finished my requirements early, and so I did an endo clerkship. And when I graduated in Maryland at the time, the head of the endo department came to me and said 2 things. One is, we want you to apply to endo school, and second of all, you've done more undergraduate endo than anybody that we've ever remembered at the University of Maryland.
Wow.
And what was happening was that, you know, back then, I don't know how it is today, but my classmates had requirements and they had to get their crown requirements done.
Yeah.
Well, you couldn't get the crown done until the endo was done. And they were waiting on post-grad endo to do that. And post-grad endo was backed up and they were sweating and they're like, how am I going to finish my requirements? So I got, like, my classmates, how will you do this endo for me? Will you do this endo? It's like, sure.
Wow.
So my days doing endo to the second half of my dental school career. And so it was, you know, it was a great experience. I kicked around endo school a little bit, but I still like the creativity part of dentistry. That still fascinated me. And so I said no to that. And I said yes to general practice.
Did you do a residency or did you go right into practice?
Right in. It was kind of a rough transition too, because I was referred by some instructors in the school to a couple different practices. One was both very high-end practices. One was in D.C., one was in Baltimore. And the Baltimore was a prosthodontic practice, and I would be the general dentist that would do all the basic general dentistry while they did the pros, and plus it would be a fabulous learning experience. And so I went there, went to the other one. Both wanted to hire me. Went to the guy in Baltimore, said, I'm interested. I'm going to take the job here. They said, super. We're here to meet with our office manager, get everything lined up. She calls me on the phone the next day, said, we changed our mind. I'm like, oh, okay, that's great. Thanks very much. You mean the dentist couldn't call me, but,
right.
Whatever.
Yeah.
And so I went to the guy in D.C. I said, I'm here. I want to accept your offer. He goes, well, I've been thinking, and I'm not sure I'm ready to do associate right now. It was good meeting you. So basically, I have a dental license. I'm waiting tables at Phillips Seafood House in the inner harbor of Baltimore.
Yeah.
I'm dying because the loans are coming due. The car's on its last leg. I've got no money in the bank, and it was high stress at that time. But I just kept my contacts, and I, went down for an interview. This guy in a place called Waldorf, Maryland, which I'd never been to. I didn't even know that part of Maryland existed. Drove down there, met with him. He had a beautiful office. He was a fairly young dentist and had all the same philosophies, and he basically hired me on the spot.
So Waldorf's like 25 miles outside DC. Is that
correct?
Right?
Exactly. So where we were I'm 20 miles headed further south and east than where we were when we were at Gaylord in DC. Yeah.
For people who aren't aware, so back in the early 80s into sort of late 80s, there's a big recession that hit our country. And so dentistry was profoundly affected. I think that was a big issue. And so I think your story is not unique in that there's established dentists that were looking to bring in young dentists, and then all of a sudden they started looking, and things were drying up a little bit, and the inflation was going up, the interest rates were going crazy. As bad as the economy has been, number of times since you and I have been practicing, we've never seen the interest rates go up to where they were back into the 80s when they were 19%. And
absolutely, ludicrous,
right? So those were challenging days, and so you're not alone. A lot of people sort of came out, and all of a sudden it's like, okay, now what I'm going to do? I gotta find something, and there just wasn't a whole lot.
What was your story behind that?
I came in. I graduated in Michigan, went to Chicago, and I did a GPR at Mount Sinai Hospital on the west side. I knew I wanted to get out of Detroit because the inflation was so bad. And in Detroit, everything revolves around the auto industry. And so the unemployment rate in Detroit in the late 80s was around 25% because everyone was affected by it. I mean, if you're an accountant, your clients are in the auto industry, no matter what you did. And so I went to Chicago, where I want to be in a community where it was less one industry related. And Chicago has, financial industry. They have a lot of different things going on. And it was close enough to Detroit that I could get back to see the family. But the thing I didn't realize is that there's like almost 400 dentists a year graduating in the city of Chicago, because we had Northwestern graduating 125, you had Loyola that was graduating 150, I think, and you had UIC that was graduating 125. And so, there was no work for dentists back when I started. And so I applied to restaurants and I got denied because they said, you're overqualified. I said, yeah, but I'm hungry. And I know I can get a free meal once a day if I'm working at a restaurant.
Exactly.
So similar stories. Those, so it's always tough, I think, if you have a connection, if you can network, I think that's so valuable at any time. And it's cycles, there's great times and there's low times. And I think that was a tough time in dentistry in that early, mid into the late 80s.
Agreed. Absolutely. And then that's, people now they look so much at like, this is crazy, these big private equity groups and these large, corporate dentistry and all the rest of that. I was like, this is not new, friends. I mean, I remember the day when JCPenney was putting a dental office in, when
Dental
was putting a dental office in, when Walmart was going to put it, this is not a new concept.
Right. They've just been able to take it much further, which for good and bad, right? I mean, I think it gives a lot of opportunities for dentists coming out who have so much debt. It gives them an opportunity to get some experience and get some runs, but but there's the other side of it also. But
and like everything, just what you said, there's good and there's bad.
Yeah,
there's groups out there that are doing it the right way. They've got the right concept. They're handling it well, and then there's other groups that they're just making it make it.
Trying to make financial. Yeah, I agree. So you started with, who was your partner that you started with?
Yeah, Alfie Buffard was his name, and he called it Appletree Dental. And he was one of these guys, a forward thinker. He called it Appletree. He says Buffard was good. That put me high in the phone book. But Appletree begins with A. So that puts it even higher in the phone book because everything was alphabetical at the time.
Right.
So he wanted to be, at least, if not the first, one of the first few. When you open the phone book, looking under dentist, you would see Appletree, and then you'd see his name further down the line. So, yep, this is just a family dental practice.
Now, was this the dentist you practiced with, and then he had a disability issue, then had to make change in your practice? So
yeah, so we were going through the process of associateship, and we really couldn't agree with anything. And it got into the battle between the lawyers and the accountants, and I had mine, he had his, and it was just getting old. I was burning cash like crazy. Just it was the tennis match. Well, here's this offer, and then back to me, and then back to you, and then back to me, and. I finally went to him. I told him this isn't working. I don't know if I'll just have to move on. And then we met a guy named Bernie Fink. And at the time, Bernie was a whatever you want to call it, practice transition guy. But his MO was a little different in that he said, I have accountants and lawyers on board, and I am the mediator. Mm-hmm. I come in and everything goes through me. And so you either say yes or you walk away. Those are your two options. So we said, well, let's give it a try. And he was the kind of guy that would look at me and say, look, he built this equity, he did this is what you got to pay for. He'd go to him and he'd say, look, this guy's been in your practice for X years, he's built some following, you're being abusive with this, what you're asking for in the contract. And he went back and forth with us, telling us each, like, you can have this, you can't have this. 6 months later, we signed the deal. So
crazy.
Yeah. So it worked out well from that standpoint. But then what didn't work out as well was 9 months after we signed that, he basically called me on the phone. He says, my back is so bad. I don't know what I'm going to have to do, but I don't want to practice dentistry anymore. It's too painful.
Whoa, no kidding.
Wow. So here I am, just 9 months into having signed all these papers. If there's a word of caution to any of the young dentists out there, my savior was we had cross life and cross disability on each other. So be sure if you're going into any relationship like that, you want to make sure you have that in place, because that saved my butt. That basically that disability insurance paid off the second half of the practice for the most part.
That's such great advice. I think young dentists or people who are getting into partnerships and associates, they really have to sort of consider the worst case scenario, right? And, fortunately I had good guidance also. But, and I've never had to deal with that, but that had to be, besides the financial stress. Now, I mean, you had somebody that you were working with, and I love practicing with somebody else. I love having someone that I can bounce ideas off of. And so I'm sure there was sort of this, in this partnership, you had that, and then all of a sudden someone steps away. So there has to be sort of this emotional thing also going on besides the whole financial burden.
And I'm freaking out. I'm working 6 days a week.
Yeah.
My only day off. I work 6 days a week. I still kept my Tuesday, Thursday evenings. I work Saturdays. I was doing 6 days a week. We were, now it's 2 dentists down to 1. And somehow in my brain, I thought I had to make sure everybody was taken care of.
Right. Yeah, for sure.
So the schedule was just jam packed, and I'm dancing from room to room. And burnout was coming very quickly.
How long did you practice at that pace for?
Probably a couple of years.
People are doing it. It's going to catch up to you. And I think people can fool themselves and think, I can do this. And even if you can do it for longer than that, your body starts to give out. There's no way the demands of doing dentistry can allow you to do that endlessly. I don't think there's anyone who can manage that. It's too hard on the body. It's too emotionally, defeating. It's just so hard.
I hate to say it, Dennis, but I think the only way you can do it is if you don't give a crap.
Yeah.
If you care about, if you're passionate like you are, if you care like you do, if you care about the patients and you care about the outcomes and you're invested in that, it's, you and I both know, just doing it at a reasonable pace is exhausting.
Yeah.
Let alone trying to do it at a breakneck pace.
I understand that somehow Brian Lesage, is Brian from he's from the Baltimore area.
Brian originally from the Baltimore area. That's correct. Yeah, his dad was a pharmacist, and he grew up in that area. And then, but they moved west, and he went to school at UCLA. But he always wanted to come back east. So, Brian and I were one chair apart in clinic for 2 years.
I didn't realize
and
that.
Yeah, and so, no surprise to you, Brian was super talented then as he is now.
Right.
So it was so great having a colleague. And then to my right was my good dear friend of this day, Gary O'Shea, hands of gold. We were lab partners. I mean, so I had these two guys that were just absolute stars. And so, as what is it? What's the term? The rising water lifts all boats, right?
Yep, exactly.
It's like playing tennis with somebody who's really good. It's like playing golf with somebody who's really good. Being around those guys, in lab and in clinic and everything, and just bouncing stuff off, hugely valuable in your growth.
You're going through these days and you're just grinding it out. And I've done that 6 days a week. That's what I did early on in my career, just every day working. And heck, I had patients who wanted to come in on Sundays, and I'm like, I can't, but there's only so much you can do.
Yeah.
And so you're hitting your breaking point.
Yep.
And so what would that look like in your career?
Two things happened kind of simultaneously. One was that I realized, I'm not doing this anymore. I'm not enjoying it. If I keep at this pace, I'm not going to be a dentist much longer. I kind of found, again, that creativity part of dentistry, the hands part of it, the artistic part of it was still in me there. And that's what Endo was not affording me. Don't get me wrong. There's art, you and I know, there's artistry to being a great endodontist, no question. But that wasn't fulfilling me. And, taking out teeth wasn't fulfilling me. And then getting halfway through a surgery with somebody on nitrous, and the surgery is getting tougher and they're starting to freak out. And,
right.
I said, that's not rewarding. So what's rewarding? What do I enjoy doing? And so, I enjoy restoring smiles. I said, that's what I love. And posterior restoration as well, the art of creativity. And so I began to look at options related to that. That's when Brian introduced me to the AACD and said, hey, Brad, this is something I just got accredited. I think this is something you definitely can do. You should come do that. Simultaneously, I went to my first Pete Dawson course.
Wow.
So that was kind of the dual, at the same time I'm getting introduced to the AACD, and I decided once I went to Pete once, and I thought Pete's kind of an older guy. I got to get through this. So I attacked his courses.
Yeah.
I went through his curriculum as quickly as I could, just with the fear of Pete's not going to be around forever. Well, I was wrong. He went on for another 20 years, of course.
Right.
But at the time it was like, no, I need to really attack this and get through this. And so that was the change.
That's so cool. So I think when people are asking me, like, Dennis, I want to do CE, I don't know where to start. And my comment is always, it doesn't matter where you start, but start with occlusion. Start with occlusion. Understand joint-based dentistry. Because if you start the opposite, then you're going to have a lot of failures, not going to understand why things are failing. So start with joint-based dentistry, Spear, Coyce, Dawson. I'm not sure what's going on down there.
Pankey.
Yeah, there's just great opportunities for dentists to be able to get a better understanding before they start getting into aesthetics. And so it's interesting that you're doing it in a parallel. So that must have been a lot of information coming at you. It's like sucking out of a fire hose.
I would come home. It would be a weekend, and I would come home and just you do, because it was back then, I think it was like a Friday, Saturday, Sunday, or Thursday, Friday, Saturday. It was some kind of combination like that, 3 days. And I would just come home completely wiped out, just absolutely exhausted. But the good kind of exhausted, the kind of wake up on Monday morning and say, how am I going to be looking at things differently? And you do. You immediately start looking at situations completely different.
You can't unsee, right? All of a sudden you're thinking all these cases that you've treated and you want to give all this money back to people. The malpractice you committed.
Well, as you and I both know too, we also got lucky too, because, it's like, they come in and I look at, how did this ever succeed?
Yeah, exactly.
How is this working out so well in this patient's mouth? And it's like, I missed so many parts along the way, but that's okay.
That's so true. That's just how it is. And
But
it took me a while to get
lucky
over
than
that.
good
Like
sometimes.
I go see Spear and I'm like, oh my God, I can't go even I don't even want to hold a handpiece, you know? But you got to get over it, right? And you just got to.
And again, Dennis, the most valuable thing that I learned early on, and what was the great quote, I'd rather have a fully adjustable brain and a semi-adjustable articulator, is that you take the knowledge, but you use it that fits you. Yep. You use it that fits your brain. You use it that fits the things you believe. And I never really drank everybody's Kool-Aid 100%. Even I just, like, one of the perfect examples of that, even after all the stuff with Pete, I just did not equilibrate every patient. I just did not see, in my brain, I said, does not make sense to me. I understand where it needs to be done. I've got the general idea. I know, especially when I do my reconstruction cases, how, crucial all that is. But, the body's so adaptable that sometimes I'm like, me getting in there messing around is probably not a great idea. And now we're seeing, I think, kind of that theory philosophy has made us circle back. Right?
Yeah, I think you're right. And I think you make a great point. I wonder, like, as you are getting influenced by two different camps, you got the sort of Dawson joint-based occlusion camp, and then you're at the AACD. And I love the AACD, but there's not a lot of emphasis on occlusion, right? So I think it's like phenomenal that you had those coming up parallel, because it probably made you sort of like, stretch yourself and like as you're hearing this, and how does it apply to what you just learned or what you're learning from other courses and stuff. So I think that's awesome to be able to do that parallel.
And the other thing too is I was excited about dentistry again.
Yeah.
I was moving in a direction. And then the other tipping point, of course, was I go to our local study club, and all the old guys, who were bitching about everything under the sun, insurance has ruined dentistry and dentistry sucks and it's not the good old days anymore. And by the way, Olson, that cosmetic crap you think you're going to do, that doesn't work down here. That doesn't work in Southern Maryland. These are good old boys down here. They got their shotguns and their pickup trucks, and they hunt and they fish, and they don't want to hear that cosmetic crap, that's just never going to work. Well, I'm sure just like you, Dennis, that's all I need to hear. Go ahead and tell me I can't do something, go ahead and tell me I don't have a chance of making it work. And that's all. That's just more fuel for the fire.
How long did it take? So once you're into your practice and you're saying, look, I can't do this anymore like this.
Yeah.
How long did it take for you to then be able to slow down the engine? Like what did you do to like take it where you're just killing yourself? You're, 6 days a week, you're just jamming it. And then you say, you know what, I can't do it like this anymore. So what did you do? Like, I mean, because this is difficult for team members, right? Staff is like, well, this is just what we do. Patients, this is just what we do. And now you're saying, I'm not doing that anymore. So how did you manage that?
I had to let half the staff go.
Oh, no kidding.
Yeah. So what I did is I had to hire, once I made the determination that, like, look, this is the late 90s, and I just know that it has to be done differently now, and I want things different. And so I looked for and interviewed a number of different people, and I found a woman who'd been in a practice where she wasn't quite doing things the way my vision was lined up, but it was much closer than anything my staff had seen before. And so I brought her on, and I said, look, this is how I want to do things. And then I put the staff together, and I said, look, we're making a change. I said, this is not going to be a run and gun drill and fill practice anymore. We're going to see one patient at a time. We're going to do comprehensive dentistry. I said, we're going to have appointments where we do nothing but record take and interview, and they're going to last an hour and a half, and they're looking at me like, you're insane. You can't do this. Our patients won't accept that. This is not. And, that's hard. That's, and again, don't get me wrong. I mean, I had my doubts on more than one occasion, and there was fear in there, no doubt about it, but I knew I couldn't go back. I knew I couldn't do it the other way. And so I finally had to just sit down with people and just say, this is the way things are going to be, and this is the way it has to go. And, 3 of them just couldn't come around. This isn't the way, they just go back to the old, now we're putting computers in, and we're getting rid of paper, we're getting rid of ledgers. And, so there's lots of things happening, and they're like, no. I said, I'm sorry, I got to let you go. wait, I've been here for X number of years, and I was here from the first day when he opened the practice. I said, I understand all that, but I'm sorry. I said, this just isn't working, and just had to hire the people that would follow your vision.
Yeah, that's great information. It's so hard to do. Oh, it's excruciating, right?
I can speak. I'm speaking to you here now casually about it.
Yeah.
I can tell you, my friend, at that time there were sleepless nights. There was, antacids being popped, like they're candy. Yeah.
Yeah. Did you work with a consultant when you were going through this, or were you just relying on like your colleagues that had maybe gone through this path, or how did you guide yourself through this?
Just a CE junkie.
Yeah.
I never, and again, Dennis, it was more back to, I love to take information and then do it my way.
Okay.
And that's the way I always worked. I never really was I hate this. This is a terrible term. We still use drink the Kool-Aid, and we really think of where that came from. And I'm almost like, I really need to stop using that term. But anyway, the idea being is that I didn't dive into one complete philosophy. Mm-hmm. I went to took the whole staff. We went to see Linda Miles a number of times.
Sure.
And just in terms of teamwork and how the team works and how you reward and how we, come together and how we, listen to one another and that type of thing. And then even remember Pete. Pete had a top 10%. He did all his occlusion-based and everything there, but he had that one, the one thing that I went to, and I can't remember, it wasn't my first one, but I remember it was like how to put your practice in the top 10%. And they had a number of philosophy. Did I do everything that was in there? No. Did I cherry pick the stuff that I loved? Yes, I did.
I think that's great. Linda Miles is one of the leading consultants back in dentistry back in the day. I mean, she's still around, I believe. I think I saw her name recently.
Yeah.
But yeah, Linda Miles is one of the leading people. And then if you don't know Pete Dawson, you need to learn about Pete Dawson. So
yeah,
I took a lab workshop many years ago. A guy named Jörg Stuck, who was from Switzerland. He was a German-Swiss denture technician. He was incredible. Yeah. And he told me, he said, Dennis, if you want to learn something new, read something old. Yeah. And he was referring to Earl Pound technique with dentures.
Oh, yeah.
And so I went and this is back in the day before the internet. And so I went to the ADA library because I was in Chicago, and I started reading about their Earl Pound technique.
Yeah, absolutely.
So if you're not familiar with Pete Dawson, then you need to grab Principles of Occlusion from Pete, take any edition, and you're going to learn a ton. But any of this information, I mean, it sort of all recycles and all sort of builds on each other. And so getting from, that basis, and Pete had that great course talking about how do you have essentially a fee for service practice. Yes. That's right. That's sort of what he was talking about. How do you control your own destiny type stuff, which I think is today as valuable or maybe more valuable than any time in dentistry.
Absolutely. And again, every era had its own challenges, so it's not like we faced our challenges. They were a different type of challenge, but there are the challenges today that we all hear and know about. And yeah, you just gotta attack it. You've got to attack it through knowledge. Everybody wants
enthusiasm. Knowledge and enthusiasm, right?
You're right. But composite is no different. You teach, how much you teach in that, and do your hands-on, your seminars. Well, what instrument and what composite? Because those are the magic bullet. If I have this instrument and I use this composite, I will get the same result that Dennis Hartlieb gets. Like, I don't think so, my friend. You'll get that by, what's Adama's famous quote is, he says, I've cut more ivory than I've cut enamel in my life. That's, you put in the hours.
So true. It's the reps and practice and learning. I couldn't agree more. Hey, dental online trainers, this is actually a 2-part interview with Dr. Bradley Olson. If you enjoyed this first part of our conversation, then stay tuned. In about 2 weeks, we'll be dropping the second part of our conversation. You can, of course, watch this full episode on YouTube or subscribe wherever you get your podcasts. Again, thanks for listening, and until next time, yours for better dentistry, I'm Dr. Dennis Hartlieb. Well, thanks so much for listening or viewing our Sharecast today. If you enjoy this and you want to get more information from dental online training, then check us out at dothandson.com. That's one word, dothandson.com. And hey, be sure to share this with your friends and colleagues, anyone who you think might benefit from this Sharecast. And please be sure to leave us a 5-star review if you enjoyed our conversation. This podcast is edited by Luna Clark and includes original music by Chris Peterson. And again, thank you for listening. Yours for Better Dentistry. I'm Dr. Dennis Hartlieb.